Thank you, Mr. Chairman, and thank you so much, Secretary Kennedy, for being here with us today. And I'm so grateful for your efforts to make sure our federal health system is laser focused on creating a healthier, more prosperous America. And my home state of Louisiana has embraced the MAHA movement, including a lot of concerned mamas out there. I'm one of them. And I'm so eager to hear from you on how we can best support your mission moving forward. And I'd love to talk about how we can work together to improve women's health research. As a woman, a mother, a member of Congress, I am deeply concerned about the longstanding gaps in research and care that affects women's health. I hear from women daily about how a simple blood test or routine screening could have prevented debilitating cancers, stillbirths, preventable diseases, and the high price tag that comes with the treatments for these diseases. In just my state this year, we can expect close to 30,000 new incidences of cancer, including 4,230 new incidences of breast cancer and 210 new incidences of cervical cancer. Louisiana's 5th congressional district already sits higher than the national average for breast cancer deaths. Yet women are still underrepresented in clinical trials. The unique biological health factors that impact women's health are too often an afterthought rather than a priority. We have made some progress with programs such as the CDC's National Breast and Cervical Cancer Early Detection Program, which has provided access to life-saving prevention and early detection services for women in underserved areas, and the Pregnant Women and Lactating Women Advisory Committee to address this gap in clinical research. But I know more work can be done. Secretary Kennedy, what specific actions will the department be taking to build on these existing programs and ensure that research funding, policy direction, and implementation reflect the full scope of women's health needs?
Yeah, I want to thank you, Congresswoman, and also take note of a fact that there was one of the canards that has been widely reported in the mainstream Democratic Party press is that we terminated a 30-year women's health study at NIH, which was reported initially in the New York Times. The report was inaccurate, really badly inaccurate. We very strongly support that. Jay Bhattacharya, who is the director of NIH, actually has done a lot of his research on that database, and we are going to continue that. We have 42 maternal health programs throughout the agencies. We're going to continue that commitment. That's a multi-billion-dollar commitment, and we're going to continue that. And I'd love to work with you directly to figure out, what we can do more to make sure that that we have great detection, that we have great diagnosis, early detection, and prevention.
Thank you. I look forward to working with you on that. I also represent a largely rural district that covers 21 parishes in Louisiana, many of which are considered medical deserts. I hear from my constituents daily about the lack of access to regular and specialized care. My district is part of the Delta region along the Mississippi River, and within the Delta, there are a number of types of cancers and chronic illnesses on the rise, and there seems to be little success in slowing the morbidity rates down. The 5th District also ranks worse than the national average in cardiovascular disease deaths, kidney disease, and diabetes deaths. This is only one part of the long history of the Delta region having poorer health outcomes than the rest of the nation. Secretary Kennedy, what initiatives are the agency planning to implement to improve health outcomes in the Delta region, and how can Congress partner with you to ensure that these plans come to fruition for our rural healthcare deserts?
Congressman, this is a priority for me during this administration, and I made that commitment to many of the senators who voted for my confirmation. It was probably the most commonly repeated concern about rural health and the decline in opportunities in rural health. We have programs at HRSA to increase personnel and frontline responders and frontline treatment personnel in those districts, which is there are chronic shortages of doctors and nurses who want to move to those areas. We are going to make sure to continue to support rural hospitals and healthcare centers. We are going to dramatically revolutionize the availability of telehealth and AI so that people can avoid emergency rooms by getting treated at home. I looked at a technology yesterday that can accurately diagnose strep throat by telephone using your telephone camera with taking one picture of the inside of your throat. And the accuracy of that test is greater than a strep swab. And these are opportunities so you can prevent somebody from having to go to the emergency room, and you could get them a prescription on site. There's so many opportunities that are so exciting.
Yes.
And we have just the right team in place to implement them and deploy them across the country. Dr. Oz, and we have Chris Klum, who is, came out of the tech industry, who is integrating AI into all of our systems there. We're really going to revolutionize this agency.
That's wonderful news. My time's expired. Thank you so much.